Another one, I don't know whether you mentioned it or not, is Helping Hearts. That group is doing a lot to help our community and those that are in need.
I didn't know about that one.
Well, it's if you got something to donate, you put it on there. You can't sell it. You put it on there, you donate it. And if there's someone out in the community that needs something that you put on there, then they have the ability or they have the access to come and get it. Or very good.
I
Lots
think
of good
that's
things going
neat.
on.
Well, and that's kind of the ways that, during the ice storm, I think we kind of took care of each other and we, what do you call it? We kind of bound together and put our boots on and helped each other. And I'm hoping that's going to be the same way this time. I see no reason why it won't.
And speaking of helping each other, again, a lot of thanks to this community, the businesses and individuals that contributed to our radio auction, and to all of those that were down there working. This young man with me this morning, Jason Williams, was there from Friday. We put the tarps down, and he was there with us till yesterday, and we're headed back this morning to finish up. So, thank you to this community for everything that you did.
He's a hard worker.
Yes, he is.
It was a fantastic auction, Roy Jean. A lot of volunteers down there helping the Optimist and Kiwanis Club get it together. Of course, the Farm Bureau, Vanna Whites of our phones were down there. But it is a whole community effort. Yes. From the donations, monetary, to the donations to the items and certificates to be auctioned off, to those that come down and do the bidding on the floor, via the phone, and then just the community coming together to support the youth of the community. And another really good auction this year, of course, really on pace or a little bit more than last year, the difference being that we had a matching grant for Ralph's pictures and Ralph's pictures and some of our country store items that we did not have this year. But as far as items and donations, at or better than last year's auction.
You take away Ralph's donations, it's the matching donation that you were talking about, and I feel like this year exceeded, many in the past. Well, I know it did. And as I told George Saturday, you were down there for a while. Zeke stayed with me. We still got a few people that need to come pick up some items, and but I thought it went as smooth as any that I've been around. And it was nice to get out of there before 1 o'clock in the morning. So it was a great auction. And again, we really appreciate this community and WPKY. You were down there every night. Tess was down there 2 or 3 nights. Beth came in Friday night.
And of course, just donated all kinds of items.
Things just kept coming in Friday. The big donation here from
the basket.
Yes.
And the neat thing about the basket was it was full of items from businesses. Of course, WPKY celebrated their 70th birthday, and most of the items, if not all the items in there, were from businesses that were here in business when WPKY signed on the air. So. And
thank y'all for, Friday was great. I listened to Willie and Twyman and several others that have been on the air through the years, and it was just super to hear those two individuals on the air.
Yes. Well, and let's be honest, the big draw all week long at the radio auction has been the hometown hero that has been there all week long. I mean, with him down there and being able to sign autographs and meet people and shake hands. I mean, Zeke
he got several calls, too.
He's done an amazing
job. People were calling the phones asking for the hometown hero.
Yeah, I'm sure he's not listening right now.
He better be.
Well, no, I gave him a call a while ago. We still got some items because of the rain Saturday, we couldn't move items to storage buildings, so we're going to do that today. Zeke's coming down, and
I pick on him, but boy, he is a heck of a guy, though. There's a reason why he's our hometown hero this month.
and he's very deserving because of the things that he did. But Ty, it was a great auction, and we're looking forward to next year.
Well, yes, it was, and thanks to everyone and the community. Of course, the school board as well for the Butler.
We just take them for granted. It's like a Special Olympics. We practice there in the facilities, and our school board we appreciate them very much.
Yeah. So thanks to everyone. We'll have a total here for you probably pretty soon. I know there's still some things coming.
And next year's the 50th year.
Yes.
So we're going to start early and.
We hope to really push to the limits.
50,
yeah,
maybe.
we'd love to do 50 for 50. So.
Well, speaking of the school board, look who's here.
Yes, indeed.
How about that? Nate Huggins. Stick around.
Thank you, Roy
Coffee
Jean.
Talk. Thank you so much.
Thank you, Jason.
Jason, we are so proud of you. Bless his heart. He plays for Special Olympics. We love that guy. 1580 103.3 WPKY.
Have you been to Big Deal Store yet? Go to WPKYOnline.com and click on Loyal Listener Big Deals. The other day, I redeemed a gift certificate on my smartphone. It was so easy. Thanks to Loyal Listener Big Deals, I found new places to eat, have fun, take the family out, and get my car fixed. With Loyal Listener Big Deals, you can save money and try new businesses. Go to WPKYOnline.com. But you better hurry. You never know how long each deal will last.
Hey guys, Heidi with Capitol Cinemas, your local Princeton movie theater with your weekday lineup. In Cinema 1, I Still Believe, PG. In Cinema 2, Onward, PG. And in Cinema 3, The Invisible Man, rated R. All 3 movies show Monday through Thursday at 6:30. Call during showtime hours at 270-365-0200 or visit us at capitolcinemas.net. Thanks for listening. See you at the show.
We've been talking for months now on WKDZ, WHVO, and WPKY about the importance of shopping at home with our locally owned and operated businesses. And they are telling us that you are making a difference. I'm Beth Mann, President and CEO of the Edge Media Group. I just want to thank you for the extra effort you're making to support our local businesses. When shopping locally, you create jobs, fund more local services, and impact our local economy. And that's a win-win for everyone. Shop local.
This is Mallory Hancock Lawrence, and we love our Caldwell and Line County friends. We invite you to come to Cadiz anytime you can to shop with us. We're making it even easier for you. Whether you work in Cadiz or just come to town for a visit, stop in and shop with us. But if you're in a hurry, you can pre-order your groceries at Hancock'sNeighborhoodMarket.com. It's so easy and convenient. Of course, we want to see your smiling face anytime we can, but if you're in a hurry, Hancock'sNeighborhoodMarket.com is the way to go. Hancock's Neighborhood Market, Cadiz.
1580 103.3 WPKY, Tess and Ty and Coffee Talk and Nate's and Smiley's. And I'm telling you, we've got the who's who today.
Yeah, we certainly do. We welcome to the WPKY studios Caldwell County School Superintendent Nate Huggins. Good morning, sir.
Good morning, Ty. How are you, sir?
I'm fine. We also have Infection Control Coordinator and RN out at the Caldwell Medical Center, Mandy Smiley. Good morning.
Yes, good morning.
Good to have both of you all here.
Thank you.
Well, and to be honest, you would think, well, that's 2 different places. Yeah, but really and
It's
truly,
not.
that's a really close relationship there between the school system, and the hospital, and especially infection control.
Yes,
You've
ma'am.
really got to have a good open line of communication between the two.
Absolutely.
So
Absolutely.
how much goes into that between?
Oh, it's very important that we communicate daily on, especially in this situation, on what's going on and what precautions we should take for our kids and our faculty and staff. I mean, it's a situation where it's the unknown and we don't know
Right.
what's coming around the corner.
It's day by day.
That's the problem. And I really wanted to stay in school this week. I told you all, I told the board that on our board meeting on Friday night. But it's a situation where we need to do whatever we need to do to protect our kids and our community.
Well, and I know some people say, oh, well, sure he did. I promise you, yesterday I looked into the man's eyes. He doesn't want to be out of school no more than anybody else does.
Right.
And
No, I don't. I mean, I would love to be in school this week because the 2-week being out of school will fit our schedule better because it would tie right in hands with our spring break. But we're going to go 2 weeks, and if they give us the green light to go back to school, we're coming back to school the week before spring break. We need to catch up on some things that we're not going to get done these next 2 weeks. So it's important that we do that to make sure our kids are ready for the assessment that,
Right.
that the state gives us.
of course, Miss Mandy Smiley. Now you might have somebody over at the school that you worry about as well, right?
I might. Yeah, just a small personal connection.
Yeah.
Well, now
There's nothing small about Steve.
no, that's true.
with you being an RN.
Yes.
What do you worry about when he comes home? Do you spray him down with Lysol? From a medical perspective, I think that's neat. When you've got somebody that works at the school school. What do you do when he comes home?
Well, we talk about the things that I am invested in, which is infection prevention. So some of the things I got to share at church yesterday as well. Just, there are basically 4 good infection prevention principles that we're trying to get out to the community. And those, the first thing is good hand hygiene. And when we say that, we mean washing your hands with soap and water. Good old traditional soap and water will do a great job of getting rid of viruses, bacteria, whatever it is we've got on our hands. That goes for children and teachers as well. If you don't have soap and water, hand sanitizer, obviously, we've talked about that. You can, put that on your hands. 20 seconds is what the CDC recommends. So scrubbing really, really good and trying to get rid of those germs. We also talk about respiratory etiquette. So y'all have heard of coughing in your sleeve. Some people call it the vampire move. There's different things they call it. But coughing in your sleeve, if you don't have a sleeve, you got short sleeves on, you don't feel comfortable coughing into your arm, make sure you use a tissue. But then discard that tissue. I don't know about you all, but I've had grandpas in the past that have kept hankies in their pockets, and they bring that out and sneeze in it, and then they put it back in their pocket. That's not what we want to do. We want to get rid of that.
On my dad, but.
Right, exactly. Yeah. We want to get rid of it as soon as possible, and then do hand hygiene, obviously. The next thing is environmental, cleaning your surfaces. So we've got high-touch surfaces. You all have high-touch surfaces at the school that your kids are touching all the time. Doorknobs, handles, light switches. You don't think about your steering wheel in your car.
Gas pumps.
Yeah, gas pumps. Anything that you're going to touch frequently, clean those, disinfect those as much as possible throughout the day. Keyboards on
even your phone, right?
Your phones,
Yeah,
absolutely. Absolutely. And then the last thing is if you're sick, stay home. We want you to come to work if you're not sick, but if you're sick, we don't want you to expose other folks. So, with this virus, there are some signs and symptoms that we're looking for specifically, a high fever, a cough, some congestion, also shortness of breath. So there are some specific things that we're looking for. But overall, if you're sick with anything, we want you to stay home.
What are some of the measures Caldwell Medical Center has done, at least at this point, for as far as in and out and those kind of protocols?
Yes. Well, as of Friday, we have limited our visitation. We are limiting at
now, you mean somebody going in and
going
visiting someone else in the hospital?
Yes, ma'am. Going into the hospital. If you're coming to visit someone, we're asking that immediate family. If you're coming with someone to a visit, like maybe an outpatient procedure, something happened in our surgery department, we would like only one person to come back with that person into that area. There may be other folks in the waiting area, but just one person at the bedside to kind of limit the number of folks back there and exposure as well. And then we've closed our cafeteria as of this morning. So
there's a lot of upset people about that.
Yes,
I'm one of
yes.
them. I like that. That's a great lunch they serve out there.
We do. We have a good dietary staff and good lunches. But as of right now, we feel like that is just to be safe and again, keep everyone safe in our community. So
well, now, and that is just as much for the visitors' protection as it is the people that are there as well, correct?
Absolutely. Yes.
You're not just trying to be mean.
No, we're not. We're just trying to protect you all as the community. We're trying to protect our patients that are in the hospital who are already sick or they wouldn't be there, and then also our staff so that we can make sure that we have a workforce available to take care of you when you come to the hospital.
And I've also heard electives that aren't necessarily something that are threatening right this second have to happen. That electives are kind of being pushed back a little.
Yeah, we haven't taken a stance on that just yet. We did have something that came out about not having enough masks and that we were postponing surgeries. That is not true. So we are still doing surgeries. We do feel like all of our personal protective equipment that we have, we've got a good amount of that right now, and so we feel very confident that we're going to be able to continue to provide care.
You mentioned at this time there's a lot of information out there, some of it accurate, some of it not so accurate. So what can we do as far as Caldwell Medical Center is concerned?
Yes.
If we have a procedure planned, if we have an outpatient, if we have medical appointments, what are some of the things that we can do to contact you to make sure that things are still on board and everything's on
Just
go?
exactly what you said. I'm glad you brought that up. Please contact us. If you have a question, give us a call. It's 365-0300. Just call us. We can let you know what's going on. If you think you're sick and you were going to go to one of our primary care providers, or if you are going to come to the emergency department, we would ask that you call us first, especially if you're displaying some of the signs and symptoms that I just went over that are part of COVID-19, so that we can be prepared as you come in. We may ask you to put on a surgical mask, just one of those ear loop masks, just to help protect, again, you and then everyone else in the healthcare system. So, but we'd be happy to answer any questions. You can give me a call, you can call Doug, any of us at the hospital, and we'll keep trying to put out information. We've put some things out on our Facebook page, so please check there. We've also put some information out on our website. There's a link at the top that says COVID-19. You can click on that with all the information there.
What would you say to folks to those of us that may be a little scared?
Sure.
There's a lot of information out there, as we mentioned, that it's just everywhere. Some of it accurate, some of it not so accurate. What
Continue to
tell
go
us?
to the reputable sources. So the CDC, the World Health Organization, or WHO, the Kentucky Department of Health has lots of information out there for you. Those are what we consider reputable sources. Stay away from social media. Some things are good on social media, but then it can also overwhelm us and create some of that anxiety as well. So, or call us if you have questions. I'd be happy to talk to you, tell you what I know. I don't always have all the answers, but we can find them for you.
I don't know.
Well, and one of the things I think that scares a lot of people is they don't understand what the severity of it is.
Sure.
Or they don't understand is this, they see beds and images of beds and beds and beds of people that and that's scary. I mean,
Yes.
We've had a respiratory thing go around over the winter. Is that close to the severity of it? Is it worse than that? Is it? I mean, I know it depends on who gets it and
It
the
does.
age group, as far as
does.
the severity. But is there anything that you can compare it to so that they can get something in their mind? Because I think sometimes the unknown is so scary.
It is.
That, that we can drum up the worst possible scenario in our head and scare us.
It's more like an upper respiratory. If you've heard of SARS, you remember SARS back a few years ago. This is actually a SARS virus. It's COVID-2 or SARS-CoV-2. So mostly upper respiratory kind of things, shortness of breath, and then that high fever. I have seen where some folks have stated they had a really sore throat at the beginning, but mostly we're seeing the high fever, 100.4, not 104, but 100.4, and then again the cough and the congestion and the shortness of breath is a key indicator. So.
And since those mimic so many other things, really
They
and
do.
truly, I mean,
They do.
you can really believe that you've got it, and
Right.
So
Yeah.
how do we know when it's time to get it tested and go to the doctor?
I would
when
say,
we say, yes, I need to do it.
Listen to your body. You know your body the best. If you're running a fever and you have those other signs and symptoms, give them a call, talk to them. They may be able to ask some other questions. Of course, travel is another piece of that. I didn't mention that, but another question that we're going to look at is, have you traveled? And have you been in contact with anyone that was positive for COVID-19? Those are some other screening questions that we can ask
And that's
as
some
well.
information out there, Mandy, as well, that my understanding, and you may clarify, that is you may not be tested unless you have traveled or been in contact with someone with COVID-19.
Sure. We're still going to test if you were to come to the hospital. We're still going to look for flu. We're still going to look for strep throat. We're going to look for other things. And then we're going to actually contact the Kentucky Department of Health, and in conjunction with them, based on what we provide information-wise on what's going on with the patient and some of the other questions, then we'll decide as a team whether or not this person needs to be tested.
What kind of test is it? Is it a blood test, a swab? What is it?
Most are swabs, just like the flu. So we're going to swab your nose.
And how long does it take for the results to come back once you do that?
They're saying somewhere around a couple of days. It just depends. As we continue to test, we're going to have more positives. So you're going to hear about more positives as we continue to test. And there are some commercial labs that are now doing some of this testing as well. But they are kind of got an influx of, so it may take a little bit longer. So. Most of the time, if you're not sick enough to be hospitalized, even if we test you and we send that off, we're going to send you home to self-quarantine.
So grab some cough drops, get some vitamin C in the house, get a little extra tissue
Yes.
maybe, but
Yes.
nothing,
Right. Just don't panic.
not
don't
cases
panic.
of toilet paper. That's probably
Right.
not necessary.
Yeah, we're not seeing diarrhea with this at the moment.
And Mandy, we should stress too, there are certain populations that are more vulnerable.
Yes.
The elderly and those with immunocompromised situations. lung disease, those kind of things. Now, don't get me wrong, there are cases, I'm sure, where someone could get into trouble if they contract it, but for the
Right.
most part,
Yes.
those that are healthy and the younger population seem to be doing pretty well if they contract this.
That is correct.
And they know
that is
who they
correct.
are, right?
Right, absolutely, yes. Those that may have lung conditions like COPD or heart conditions like, long-term heart disease and CHF, and, those that maybe have uncontrolled diabetes, just different what we call comorbidities in the healthcare world that could make them more vulnerable, or those immunocompromised folks that already have other things going on. So, but yeah, we are seeing that the young are doing pretty well with it.
Yeah.
So
Good excuse for spring cleaning.
Well, the students are the ones that could carry it back to their grandparents or
Absolutely.
great and uncle.
Absolutely.
Somebody as old as I am, 65, that could possibly have situations, and
It's a
that's the
concern.
reason that was major concern from the governor and the state health department that we should be as cautious as we possibly can, because we don't know.
Absolutely.
We haven't tested anybody positive that I know of in Western Kentucky
We have not.
as of today.
Right.
And I read yesterday that we have 20 confirmed cases, I think, in Kentucky.
yes.
So, it's a situation that we all have to be cautious of and do our due diligence.
We talked about that bell curve on Friday when we had our meeting.
Right.
We were all together, and we're just hoping that we can slow the progression of it, maybe extend it out over a longer period of time where we don't have the spike like some of the other countries did and overwhelm the healthcare system as well.
And that's
So-
where the social distancing comes into play.
Absolutely.
Exactly.
Kind of learn from their mistakes so that we don't make the same ones.
Yes.
Our teachers are working and to be able to help with the kids. And my direction to them is to practice the social distancing 6 to 8 feet apart. If we meet in rooms and we spread out, we can collaborate from 6 to 8 feet away and make sure that we follow those guidelines and continue to wash our hands. And we should have the cleanest schools and buses in the nation by the end of these next 2 weeks.
I'm going to say, well, in case you're just joining us, we've got Superintendent Nate Huggins from Caldwell County School Systems, and then we have RN Mandy Smiley. I'm sorry, I always
It's okay.
I always mess that up. At least we called your husband Slimy a couple of
we did
weeks
call
ago.
him.
So
Yeah,
that's
he's got slime.
Yeah,
Yeah,
we,
he's slime.
we got the Smiley
I've got
right.
a picture of that.
But from the Caldwell Medical Center. And I think this is a neat that both of you guys are in here, because, again, when you talk about those meetings, now those happen on a regular basis, right?
Exactly, right.
Yes.
Yes.
This isn't a one and done kind of
the
thing.
ELC met last week. We all got together. There was about 62 of us in that
think-
room,
yeah.
something like that. We didn't practice the social distancing in that room, but we all got together and talked about our concerns for our specific areas throughout our community.
Well, and
It was
I
great to see all the agencies there to
Yes.
to start putting our plans together.
And we have a fantastic director, Joy McCaslin.
We really
Yes.
do. Joey does
our
a super job for us.
first responders and everybody in
Yeah,
that room, I know,
Mm-hmm.
have the public's best interest and public health in mind. So that's a positive, wonderful
Yes.
thing.
Right,
Yes.
it really is.
Well, I know it took a lot to make those decisions to close the schools down, and to, it wasn't an easy decision to look at kids and say no more sports, let alone.
Well, and we're going to be closed for sports or any sports activities, even practice. You cannot have practice. Commissioner of KHSAA has put out that we will not have practice organized athletics in any form or fashion.
And that includes weightlifting, guys.
13th until 13 April. And then they're going to make another decision at that point. So we will not have practice. That doesn't mean that the athletes cannot continue to work on their skills and do that individually.
Right.
And my recommendation is that the track folks go out and run. The kids that are on the team, the soccer kids for the middle school go out and work their moves individually out in the field somewhere next to the house or in the front yard, whatever.
And they're good about doing that, by the way.
And those kids and the baseball players need to continue to work out, exercise, and
It's a good time to get some fresh air when the
fresh
weather's
air.
good,
And
isn't it?
you can go with a buddy and throw baseball back and forth, or softball. Go out and pitch the ball to somebody and take the hitting practice.
They're good about. Whoo, hello.
Well, there you go.
Well, I want y'all to see this right now. My phone is ringing. Guess who that's from? That's from you, Nate Huggins.
Is that
It's
for me?
365-8000. No, but I'm saying that because you know what that is. They're updating me because I'm a mama of 3 kids in the Caldwell County school system, and that's our one call system.
Yeah.
And I promise you that is Will Brown.
He's talking
and he is
about food
updating.
service, and I've got some information about that. You've already covered that. I listened to you earlier, giving out all the information about calling your respective kitchens for your schools. Those numbers are on our website. Please go to our website. If you don't have that capability, call your respective schools Or if you don't have their number, call 365-8000 and ask the ladies at the central office to connect you to the primary school, to the middle school, whatever. But 365-8000 is an easy number to remember, and they can connect you to a specific number if you don't know the number
Right.
for the school in question.
I think that's so important, though, really and truly. I mean, because, and a lot of people say, well, I'm embarrassed. No. This is your children deserve this. This is something that they are supposed to get. Make sure that, if you can at all make that possible.
Please call the kitchens and schedule your lunches and breakfast. We have a plan to put that together. We talked with all the bus drivers this morning at 7 o'clock at the Butler Building. They're going to be a big part of that in delivering meals, but we have 20 sites, I believe, that are on our form on the internet where you can pick up a meal for your kids. But the kids must be present with you. But because of FDA laws and regulations, you have to have the kids sign for the meal or be present with the parent to come get it.
And in my case, Granny's going to bring Eli over there, and probably, and that's okay as long as Eli's there.
We will get the food to you. And so please, I'm prepared to drive my SUV along with 5 others that we have in the district. And we'd like to transport those by SUV instead of buses because it's cheaper to use the SUV than it is the buses to transport meals. So our plan is to come together as a team, and it doesn't make a difference what your responsibilities are in our district. We're going to do what's best for kids. And we're going to get the food to them, and we're going to get whatever else they need to them. And the assignments, if you don't have the ability to get online with a computer, please call your schools this morning and let them know that. Because they need to know whether or not we need to bring you instructional packets out to your house so your child can complete that. And parents, the NTI, the non-instructional days, they count toward school days. So we won't add 10 more days to our calendar to finish up in June. These days count, so we need to make them count for the education for our kids. So please make sure if they have an assignment, and they will have an assignment, make sure they complete that assignment, because we will schedule a pickup, or we may ask you to go to a drop-off location where we have the food to drop your assignments back at that location. We'll take those assignments back to the school.
And I'll admit, I'm one of those mamas. I don't have access to the internet where I'm at that is reliable. I don't have the computers and the laptops and all of that stuff at my house. But I have children that need access to that education.
Right.
So that's what, at my house, that's what we're doing. And for others, it's Google Classroom.
Google Classroom
and
the Remind app. There's the elementary uses Google Classroom. The middle school uses Google Classroom. They do the Remind app for the primary school. And we gave out a lot of information on the 12th before we closed because we knew that this possibly could take place. So we passed out a lot of information on that day, on the 12th, to kids. Some teachers went above and beyond and went ahead and gave out packets for the first 2 or 3 days of this NTI process. So please call your respective schools if you don't know what's going on with your child's assignment and coordinate that. All the teachers today are supposed to communicate with all students to make sure we have a viable communication platform so we can talk with kids and parents to make sure we get them the educational materials that they need.
Well, and I will say, too, they had told us the Remind app. Now, that's not just, you can get that on your phone, too, because I get that with coaches and teachers and everybody.
They use it quite a bit in the primary school. Now, elementary uses it some, and I don't know if the middle school uses as much as the elementary.
They do.
So it's available. Please, parents, if you don't have that Remind app on your phone, talk to somebody at the school. Call the central office, ask to talk to Lee Prowl, our information technology director. If you have problems working through the internet, please call her for those questions, and she can walk you through the process on what button you need to click to find the assignment for your child.
I will say, I got through it, and if I can get through it,
I'm the
world's
acid test
worst.
for technology. I went on there this weekend, and I even gave my wife the phone. I said, okay, you click down to see if you can find the assignment for the elementary school. And she clicked through it, and she found the right link. So please go to our website. If you don't have that capability, please call your respective schools and get it.
And I will say, Ty and I both are parents of kids in our school system. And I want to thank you guys for going above and beyond because you have. Yeah. And there was a lot of those things that you didn't have to do, you weren't required to do, but you did because you care about those kids.
Exactly right.
And I appreciate that. And I want you to know that there's a lot of parents and grandparents out there that really appreciate it.
Yeah,
they certainly do.
It's a situation where they're our leaders of tomorrow, and we have to do everything today to educate them. We have to get them ready to be on their own 2 feet when they walk out of our school buildings. On the graduation day this May, on the 22nd of May, we want our seniors to be ready to handle life as it comes to them. And you can't do that by not sitting back and say, well, I don't have to work today. You're going to have to work every day. And this is going to cause a lot of communication between us and all the parents. And please, again, I can't emphasize enough, contact food service, the kitchens for each of your schools. If you don't have that number, again, call 365-8000 and ask them to connect you to the kitchen at the primary school, the middle school, high school, elementary school. And we'll get the food to you, but you need to do that. We get reimbursed for these meals from the federal government. So please, parents, request food service to bring you lunch and breakfast.
And don't be embarrassed either, because I think everybody understands. When those kids are home for 2 weeks, that puts the grocery bill up at home. I'm sorry, but I've got teenagers now.
If you go out to Walmart, you'll find that a lot of shelves are bare because people have been going back and say, we're going to be kind of locked in for 2 weeks. And
there ain't a chicken nugget in sight, I'm telling you, or a hot dog.
Yeah.
And it's registration today. Meals will start tomorrow. Is that
Meals
correct?
will start tomorrow, right. Registration day, I think, starts this morning at 11 o'clock. So please call the kitchens. I can't stress that enough. And if you have any questions, call 365-8000 and you ask to talk to me, and I'll be glad to help you with it. My folks back in the office are going to say, why is he putting that number out? It's going to be trying for all of us. And I talked with all the bus drivers this morning at 7 o'clock in the Butler Auditorium, and I told them that this is uncharted waters. We don't know what the next step is. There's no playbook for this. I can't say north 36 right on go. We don't have a playbook for that.
Yeah.
So we're going to take it day by day, and it could be second by second. If we get information from the governor's office and say that we're going to now direct you to do this. We're making plans. If they tell us that we cannot go to schools and all teachers need to stay home, we're looking through plans now to implement that if we have to. But right now, we're not. We're going to go to school. They're going to be available. If a parent has a question about, or a student has a question about an assignment, they can call the school and say, "Can I please talk to Mr. Miller, for example? I don't understand this question that he's given me." Our teachers are going to be available for you. So don't hesitate to call us.
Well, and I'll tell you, there's, Ty and I were talking about when we first got here that, people say, well, what do we got? I have no idea. What do you think? I have no idea. That is my split answer, right? I don't know. Ask me. You got to ask somebody smarter than me. But I think we're just going to have to kind of play it ear by ear and day by day and see how it goes. And of course, Mr. Smiley again and Miss Mandy, we saw them out over the weekend getting groceries. And the one thing I like to see is when the kids and the administrators and the teachers, Mr. Smiley is so sweet. When he sees one of those kids out, he's just got to talk to them. And I think that is what's going to help is the communication.
Right.
But getting it from the source that it needs to come from. I think we have to be very careful in where we get our information from and who we get our information from.
Don't take hearsay, please.
I think you go directly to the source that you're trying to get to, because they're the ones that are putting out the official information, whether it's, if you are curious about this particular virus, the CDC, the World Health Organization, the Kentucky Health Department, and the school system.
Right.
Go to the superintendent's office, to the school board.
By all means, call me.
So that's what's important.
And if you're going to release a release,
I would.
Where are you going to release it to? Where do let's say let's don't believe everything you hear on social media. Right. If you wonder, is this a real release from the school system?
You'll get a one call from me. If we change or from the director, like you got a one call twice yesterday from Will Brown regarding our food service.
We just got one this morning.
Yeah, you got one this morning. So it is a situation where communication is going to be vital to our success or failure in this situation. If we don't communicate properly, we're not going to do very well in taking care of our kids and our community.
What if they've changed their number and they need to make sure, or if they need to add a number?
Call the school and add your number, update your Infinite Campus information. Because if we need to bring you a meal and the information for address is not right, that's a situation where you may or may not get your meal. You may have to drive in to come get your meal.
You know, at the beginning of the year when they say, why do we have to fill out all this paperwork, and parents, and I do too, fuss about having to do it every year, but that's
This
why.
is it.
That's the reason.
It's vital. And Mandy, of course, we can rest assured Caldwell Medical Center prepares for things
Yes.
such as this. I remember
We have-
several years ago we did an extensive infection control training out there.
Yes.
You were part of that.
Yes.
And yes, this is uncharted water,
Right.
In some respects, but yet you all are prepared for this.
We are. We have actually been meeting for probably the last 6-7 weeks. You know, as soon as this first started at the end of 2019, we got a team together, and that consisted of some of our physicians in the emergency room, our environmental service team, myself, Mr. Odegaard is the CEO. We've been meeting our director of nursing, and then also our ER manager has also been in those meetings. We've been attending any Kentucky Department of Health webinar that they've had that we can get on and listen to and gain more knowledge. And then we've been putting into place our own practices. We've been meeting every week, and then it kind of came down to every day, and now we're meeting more than once a day. And when I leave here, I'm going straight to Mr. Odegaard's office so we can talk about, you know, developments over the weekend and what kind of things do we need to think about now that maybe we, you know, haven't really thought of to this point but need to address going forward. So we are prepared. And you know, again, just reach out to us too if you have questions or concerns. Please call us. They'll get you to me or someone else at the hospital that can help answer your questions. And if we can't, we'll find the resource that can, and we'll take care of this community. So
Well, before anybody was really quarantining anybody, the Caldwell Medical Center had come on and talked about new breathing apparatuses and different
Yes.
things that you all had done in preparation for
Yes.
just in case way back when. So
Yes.
kudos to you all
Thank you.
because, I mean, that was really, you had a lot of foresight and a lot of preparation in that.
we did. Thank you. Yeah, we've worked really hard to preserve our personal protective equipment, and then we've started using some new equipment that we were so blessed to receive, and we're very, very fortunate to have that equipment for our patients and our staff.
So God forbid we need it, but at least
Right.
we are prepared.
Yes, ma'am.
Exactly.
That I think that's a big kind of a weight off of a lot of people's
Yes.
shoulders. It's just knowing that, look, if it does happen, we don't want it to happen, but if it does, we're prepared.
Right.
Absolutely.
I mean, we're looking at every aspect of this from the school side of the house, and what we need to do, and what could happen, what may happen, and we're trying to make a contingency plan to make sure we can follow through with that to take care of our kids and our community and our faculty and staff.
Well, I'm more worried about my baby. If anybody, I'm a mama bear, so
Well,
when it
I
comes to my
understand.
babies, that's what
Absolutely.
that's what I'm worried about.
Well, legally, I have 1,820 babies.
You need a new hobby, Nate.
I just wish I could use them all on tax write-off. The government would owe me big bucks. But
You need a new hobby, buddy.
I take personal responsibility for these kids, and I want to make sure that they're kept safe, and we do everything we can to educate them the best we can for the next. Because this NTI is new to us, and it's new to them. So please be patient. It may be a day or two before we can get the assignments out, and everybody has one. But please call your respective schools. I can't stress that enough. If you have a question about your child's assignment, please call your school and ask questions. And again, the Remind app, the Google Classroom. We're going to try to do most of this by technology for the high school. If you don't have that capability, please get with the school and we'll work through it.
It's new for all of us.
It really is.
Absolutely.
So thank
But I
you
just
guys.
wanna-
I'm so glad you're both here together. I think that's perfect.
that was a great opportunity to
Yeah.
talk from both sides of the
Yeah.
house, from the medical side, from the school side.
Well,
But I want to say kudos again, a shout out to our board, because they are on it as far as wanting to do what's right for kids. And they as well want to be sure that we're as safe as we possibly can be, and then we do everything. I was in communication with them Saturday and Sunday, and I want to put a shout out to all our faculty and our staff, administrators, because we worked this weekend. I sent them a text. I said, we need to consider this. Please get back to me with your communication plan. And I had all 4 principals send me the communication plan this weekend.
Oh, Will Brown
So-
hadn't slept in a week.
Yeah, no, he's been hard at it, and he did a phenomenal job on his one call message. He said, I'm not used to doing this. I said, well, I'll be glad to help you. He said, no, I'll do it. But so
He's done great.
He's done a great job, really has, and he will take care of it. He'll deliver himself. I mean, he's on the driving schedule as well as I am, and Ms. Wetzel, it doesn't make a difference. We're going to get meals to the kids.
Give these teachers and administrators some love
I
and,
guarantee
and
it.
some thanks when you see them.
But communicate, please.
Well, thank you for you all
so much.
Yes.
Thank you for the invitation. And,
Yes.
and Ms.
Anytime.
Smiley.
Yeah,
I've
It's been a
enjoyed it.
pleasure enjoying talking with you this
You
morning.
too, as well.
We can have one of these
And if
whenever.
something we can do from the school side, from the medical center, please don't hesitate to call
And
us.
vice versa. Thank you.
Thank you.
Of course, Miss Mandy Smiley is an RN, and tell them exactly what you do out there.
Well, I do infection prevention, so this is right up
This
my
is your
alley.
wheelhouse.
This is it, yeah. So, and along with some other things.
it's a big
but
job.
right now, IP is my main focus right now. So,
And taking care of Steve, that's a full-time job.
Well, I mean, there's that. And then, of course, Mr. Nate Huggins, he's our superintendent for Caldwell County School Systems. We sure do appreciate both of you.
Appreciate
Thank you.
Thank you.
Stay safe and have a lot of patience with us.
Well, I have some information here that I've put out on the internet and also to an email I put out to all our employees. I gave that to you so you can be updated on what our people know.
Oh, well, thank you. And thank you all. And stick around. Of course, we're going to have all of our updates, including our weather's right now. How about that? Here you go, Ty. What's our weather look like?
Here, we got a 20% chance of early morning showers. Should be giving way to clouds. And a high today, what is the high today? Up there, around 48. Then tonight, showers likely overnight, a low down to 44. 30% chance of showers early tomorrow. Then cloudy in the afternoon, a high 58. And as we head later in the week, it's going to get warmer and rainier. Unfortunately, showers and thunderstorms possible Wednesday in the afternoon. High will be pushing 70. Same thing for Thursday, mid-70s for highs and rain. Warmer weather and showers all the way through the weekend till about Saturday. Saturday should be a nice day as this rain clears out of here. But today, slight chance of showers this morning, just cloudy in the afternoon, a high 48. It is 42 and cloudy at WPKY.
Your WPKY Weather Edge Weather Center forecast is brought to you by Fredonia Valley Bank. Serving Caldwell County since 1950. We're 1580, 103.3 WPKY Princeton.
Kentucky barbecue. There's nothing like it.